Hello and welcome. My name is Lucas Busek, Regional Director of EMEA. My colleague Greg and I are going to present you over the course of the next 45 minutes who Pulsara is and how our platform can help your organization. Over to you, Greg.
Good morning, everybody. Thank you, Lucas, for the introduction. My name is Greg Brown, and I'm the Regional Sales Manager for the Western US with Pulsara. I'm also a registered nurse with an extensive background in emergency nursing around the Seattle area, and I'm thrilled to be here today to speak with you about something that's very near and dear to my heart, and that is patient-centered communication during an emergency. It was a huge pain point of mine, coordinating care, especially during off hours in the emergency departments where I worked. And so we're also going to discuss how Pulsara can be used to optimize your communication pathways and processes to drive down care times for your time-sensitive patients, as well as how it can be used to help in response to situations like COVID-19, which has been kind of course, gripping the planet and stressing our healthcare systems around the world. Pulsara is a mobile-first, cloud-based communication platform that allows for cross-organizational communication. Again, Lucas is the Regional Director for EMEA, and my name is Greg Brown, and I'm the Western Region Sales Manager. I'm going to share our contact information at the end of this presentation. Please reach out to either of us with any questions you may have. We'll be happy to answer those for you. So when we start discussing communication in healthcare, it's no secret that we do it very poorly. We use old-fashioned technologies, we use outdated systems, and it's very siloed and point-to-point and operator-dependent. An example of this would be the ambulance service using a radio to communicate about a critical patient to the hospital, right? Then the hospital has to use their internal processes, excuse me, the hospital has to use their internal processes to disseminate that information out to the care team, which could be pagers and call lists and things like that. If this is a patient that needs, say, a 12-lead EKG transmitted to the hospital, more technologies come into play, and it's very inefficient. That's not the only problem that plagues healthcare communication, though, right? The inbound ambulance service is only one piece of the puzzle. What about that patient who's having their event up on the inpatient units? Or maybe they're transferred into your facility? Or even to complicate matters worse, what if this is a patient you need to send out of your facility to the trauma center or maybe a specialty hospital or tertiary care center to get services you don't offer? Each one of these kind of buckets of work creates a communication problem that makes our care and transitions of care very inefficient. And when you look at our traditional approach to communication in healthcare, I'd mentioned earlier it's siloed, right? Because every time that we want to bring in somebody to the care team or alert somebody about a condition change, because we operate in a point-to-point method, that means we have to start our process over every time we want to communicate. That means repeat phone calls, that means delays in care, and that means numerous opportunities for missed communication or dropped communication. And when you kind of dive into this on a more case-by-case basis, you can see that patient there on the left is having their event. As their care evolves and their case evolves and that care team grows organically as we tag in new services, the communication map gets more complex. There's more methods being used, which leads to more opportunities for what I had mentioned before, dropped and missed communication. And that leads to what I call clinical dead space, right? And those are those 2 to 3 minute chunks of time where you're waiting for a call to be returned, or maybe you have to do a repeat phone call to clarify some information. Those all stack against us and the patient and can lead to delays in care and poorer outcomes. As we all know, we want to drive down those care times, save that tissue by reperfusing it as quickly as possible. So all of those mixed technologies, that siloed approach, and that inefficiency can be replaced by Pulsara in 3 simple steps. First, we create the dedicated patient channel. We build our team in real time, and that can be across organizations, like I said earlier, and we communicate. And because Pulsara is mobile first, we can really harness the power of mobile technology and allow for synchronous communication like live video or phone calls, or asynchronous communication like group text messaging or pictures or audio clips. With Pulsara's approach of placing all care team members on a unified platform, Pulsara becomes the communication solution of choice for your healthcare agency. With Pulsara's unified, patient-centered approach to communication, you can ditch the rigid point-to-point communication process that plagues healthcare and instead choose a flexible, dynamic platform that can be used for all patient types and that can be used to pivot and build teams quickly when patient conditions change. And because of that flexibility that Pulsara offers, it is incredibly scalable. It allows for your organization and your clinicians to have one way to do their job. It doesn't matter if it's a response to a patient coming in with a cardiac event from the ambulance service, to a response to a regional response to a COVID emergency or another type of emergency. The workflow remains the same. You create the dedicated channel, you build your team in real time, and you communicate. And again, this isn't limited to within the walls of your organization. You can tag in any community partners or any healthcare partners you need to coordinate care for this patient. Pulsara's patient-centered approach to communication adds incredible value to your healthcare agency. The unparalleled interoperability at an organizational, regional, or even national level allows for Pulsara to easily meet all the goals of the quadruple aim. When discussing patient-centered communication in emergencies, there really only is one ideal solution, and that is Pulsara. It puts everybody on the care team on a unified platform and creates shared consciousness about the patient or event and drives down care times and optimizes patient care. The purpose of Pulsara is to improve the lives of our patients and caregivers through innovative communication. We want to drive down those care times. We want to improve outcomes. We want to really ease the burden on inefficient communication that plagues our healthcare providers in the current system. So now we're going to dive in a little bit deeper and take a look at Pulsara's patient-centered approach to communication in a time-sensitive emergency. Again, it can be used for any patient type with any condition from anywhere, but today we're going to be focusing on cardiac events or STEMIs. Being a mobile-first platform, Pulsara can be used by any member of the care team to initiate the case for that patient. When we start talking about communication in cardiac events, again, if we look back at the old way, it's that patchwork communication approach of multiple technologies trying to tie together multiple people to coordinate care for one patient who's having an emergency. There has to be a better way to do this, and that better way is very simple. You put everybody on the same platform, and that's what Pulsara does. That consciousness about the patient is shared throughout the entire care team, and information is seamlessly transmitted back and forth to everybody involved in the case. Pulsara's vision is to be the accepted evidence-based standard of care. You see some data scrolling across your screen right now. That is actual data from our partners here in the United States. And then on the right, you actually see the data from our Australia partners. Impressive to me is that they actually had a 54% reduction in treatment time for their STEMIs of door to balloon and 30% for strokes. So now I'd like to take this time to show you a quick video of the power of the Pulsara platform and what patient-centered communication can do for your patients.
Medic 23, Medic 23, engine route to 20400, Interorg 484, for a 49-year-old male with chest pain. 55 has been auto-launched, 13 minutes out.
Medic 23, receive health route.
So I'd like you to chew 4 of the low-dose aspirin.
Black Fly 5, have an auto launch, scene request in Garrison.
Alright, June Fly, guards closed, air conditioner, pitot heater, warning lights are out, rotors 100%, cat A's on, engine lights.
Lapcom, Black Fly 5, do you have any patient information?
Just killing it. When did that start? About an hour ago. Let it go, kept worse and worse and worse. Alright, it's definitely a STEMI. Make sure we keep flight coming. Let's activate on Pulsara.
Copy landed.
EKGs uploaded from Zoll to Pulsara.
Looks like we've got some ST elevation here.
I've got all the chambers that look good. Nice wall movement. Looking good. You're clear over here.
Hi, are you Mr. Bailey?
Yes, ma'am.
I'm Kim. I'm one of the nurses. We're going to take good care of you.
So here we're starting to.
And looks like we're across the lesion. We've got good blood flow.
Wound time 11:40.
So you see the power of patient-centric communication through Pulsara and our time-sensitive patient workflows. But Pulsara can be pivoted to use on any patient type or any event. And so the telehealth story will really be linked to COVID-19 forever. And that is the need for mobile, rapid deployable, and dynamic telehealth to avoid exposure of clinicians, to help reduce PPE burn, and to really kind of help support the healthcare system as we scramble to figure out what was in store for us with COVID-19. And so as we were kind of all trying to figure out what to do, telehealth was going through an evolution as well, right? There was the initial response and need for a communication platform. And then what can we do to help support the healthcare system and then enter into the new normal of the telehealth practice? So with that new normal of telemedicine and telehealth practice, we saw a lot of great innovation from our Pulsara partners here in the United States, especially early on during the pandemic when everybody was really looking for a solution to help mitigate this crisis that we were facing. And our partners in Colorado Springs actually reached out to us and said, here's our idea, can you make this happen? And we were ecstatic to jump on board. It was a 911 initiated telemedicine program with the goal of helping to reduce unnecessary transport of possible COVID patients to the emergency department or unnecessary clinician exposure. And they did a fantastic job of spinning up this program and using a flexible patient-centric platform like Pulsara to mitigate the surge of COVID in their community. And so what they had done is they were early adopters of our Pulsara patient application, which is the patient-facing side of Pulsara. And it's a very simple way to get telemedicine into the hands of every possible patient in a region. They have a very guided install on the, and it's a one-way call, a secure call receiver for the patient. And for the clinician, it's very simple. You add them to the case, you tap on the video icon, and you can communicate with your patient through secure telemedicine. So I'll show you what that looks like here with our COVID-19 demo. I'm going to be demoing loosely some of the models we've seen throughout the United States and how Pulsara has been used by some of our partners. Okay, so now we're going to really dive in and take a look at the Pulsara platform and its patient-centered approach to communication for a patient who's having a cardiac event. In this case, it's going to be a STEMI. The device on the left represents our ambulance partners. The device in the middle represents the emergency department, and the device on the far right represents the cardiologist and definitive care team for that patient. Once the ambulance service is on scene and they see the patient is having a STEMI, they'll choose the STEMI module. From here, there's just a few pieces of information required to build that dedicated patient channel. We're going to set the patient time, and we're going to set a first and last name. If you don't know it, you can simply tap unknown. Now from here, you can choose to start the case now and update more clinical information as you get it, or you can add it now. I'm going to add it now. I'm going to put in an age, a gender, and I'm going to attach a 12-lead EKG from my monitor directly to this case. I'm using a Zoll X-Series integration that we have. And there's more clinical information you can add as well. I've attached the EKG. If you want to record your audio clip and replace the radio report, that goes right here. You can attach images. So here you can take pictures of med lists, any clinical information you want to pass off, or even monitors for updated vital signs. The last step will be to choose the destination hospital. You set your scene departure time, and the ETA is auto-calculated. To create that dedicated patient channel, the ambulance service now simply taps alert. This alert gets pushed over to the hospital emergency department, where they'll hear a siren and see a drop-down banner. To acknowledge the case, You simply tap that banner, and the ambulance service is updated that the ambulance service is now updated and know that the patient is coming in. From here, in order to activate the definitive care team, the emergency department simply needs to tap activate. That definitive care team will get the same siren and be plugged into the case. What's very unique about Pulsara is you actually get accountability and transparency to who's responding to the case. Keep an eye on Steven's special team. You see that hourglass? Once I open the case on my device, that will immediately turn to a green check mark. So now, in the emergency department, you get real-time feedback as to who's responded to the case and who has not. From here, you can also launch a live video call or phone call by simply tapping the icon that corresponds with what you'd want to do. And that's not just limited to within the hospital walls. You can actually do that with your EMS ambulance partners as well. We've now created that dedicated patient channel. We built our team in real time, and now we can communicate. I already showed you the phone calls and live video features of Pulsara. There's also a text message feature that's a group messaging function. Let's say in this case, the patient has had a change in condition in the back of the ambulance, and they've had to intubate this patient. EMS can simply alert the team with a quick text message. They'll select the text message bubble. They can either free text it in, they can do voice to text, or we can build custom template messages for your agencies. Here I have a custom template message that the patient's been intubated. They're going to share this information with the team with 2 taps. That replaces the need for a repeat phone call or a repeat radio call to report a change in condition. From here, the emergency department can also build their team dynamically based on this new information. They'll simply come to the Update Teams button and find the corresponding team member they need to add to the case. In this situation, we're going to add our respiratory therapist. With 2 taps, we replace the phone call, saving precious seconds and minutes for that patient. On the far right, we're going to represent the cath lab team now. Once they are in once the cath lab team is on site or the cath lab is ready to receive the patient, they can alert the entire care team by simply sliding this tab over. The flexibility that Pulsara offers is also incredibly powerful. They could also put this information in a text message or launch a live video call to the ambulance, letting them know that the cath lab is ready to receive the patient. Pulsara also captures great data passively, like I had mentioned before, by simply using it to communicate. Once the patient hits the door of the ED, you can set a door time, and a timer is started. You can also set a time for a departure from the emergency department. Setting that timer also alerts the definitive care team that the patient is in the department. Once the case is completed, and I think this is very powerful, especially for our ambulance partners, the end clinician will choose stop and then choose the appropriate reason for stopping the case. In this case, we put a stent in this patient to have a device across the lesion. Once I confirm that the case is over, everybody involved in the care of the patient gets a case summary and real-time feedback. From here, we're actually seeing end providers take pictures of before and after perfusion studies, EKGs, and leaving narratives, either in the audio clips or text messages, explaining to the team what they found. It can be something as simple as 100% LAD, good job team. And that concludes a demonstration of the STEMI module for patient-centric communication with Pulsara. Okay, now we're going to dive into a demonstration of how Pulsara can be used for patient-centric communication around more global or regional emergencies. In this case, I'm going to be walking through a demonstration of how we've seen Pulsara being utilized to help mitigate the stress that COVID-19 has put on some regional systems of care within the United States. So I'm going to be kind of doing a version of that 911 initiated telemedicine that they're using in Colorado Springs. So they're going to be using the general module, and we're going to be having the EMS partners here on the left and the physicians on the right. So our EMS partner is going to select the general patient module. And the workflow is very similar to the STEMI workflow that I just showed you guys in the STEMI demonstration. They're going to set their at-patient time, and they're going to put in a first and last name, and they can add more clinical information if needed. In the general patient workflow, there is a box for a chief complaint that is required. So here I'm going to put in the reason for contacting my medical control. Coronavirus symptoms. The EMS agency creates the dedicated patient channel. From here, they can now consult with the emergency medicine physician who is taking call in their virtual care center to help mitigate COVID-19 response. They'll select the consult feature, select the medical control, and then they'll select the person they want. They want regular medical control, and they share this information with them. Our physician is now added to the case and can look at all clinical information. From here, again, pictures can be added, audio clips can be made, and there can be family contact information added as well. Once this patient is ready to be seen by the physician through telemedicine, EMS can coordinate that with the doctor either through a text message or a phone call. I'm going to request a video call in 5 minutes from the EMS provider. Please be ready for video chat in 5 minutes. That request is then sent to the emergency physician. After 5 minutes has passed, they can come down to the Team Alerts tab and launch a video call with their EMS partners and have point-to-point telemedicine visit with that patient. That is one way we're seeing Pulsara being utilized to help mitigate the COVID-19 response in certain areas. It allows for the medics to have telemedicine visits with the doctor and that patient and to help coordinate their care. The effect we've seen this have is reducing unnecessary transports to emergency departments and helping mitigate exposure to clinicians. All of the data is still captured like it was with the STEMI case. So here the physician can dictate an audio clip note, they can put it in a text message, or they can take a picture of a note that they have from their EHR. It offers incredible flexibility and can be spun up for any agency of any size and any hospital of any size. So that is just one way that some of our partners here in the United States have been using Pulsara to help mitigate the COVID-19 crisis that they've been dealing with. There's also another way they've been dealing with COVID-19, and that is through our Pulsara patient application, which is a HIPAA-compliant video viewer for the patient. It's an application they download, and it's a patient-facing side of the platform. So I'm going to go ahead and show you a quick video of how that works.
Pulsara Patient allows a patient or another approved individual to receive a secure video call from any care team member. Adding a patient or authorized contact to receive secure video calls is simple. Within Pulsara, a care team member simply adds the patient's mobile number and sends them an invite via text. If the patient or contact does not already have Pulsara Patient, they are guided through the process to install the app and are then added to the dedicated patient channel. This enables any team member to initiate a secure video call, and the setup process is typically completed in less than a minute.
And if you have any more questions about how Pulsara can be utilized to help mitigate COVID-19 and optimize your response to this pandemic, please direct you to our website at pulsara.com/COVID-19. There's a lot of great information there, some stories and testimonials, and you can reach out to myself or Lucas, and we'll be happy to share some of the successes we've seen throughout the company. And we're going to open it up for questions and answers. So please take it away. And again, please email us with any questions you may have.